a local company that's really doing some interesting things when it comes to the compostable product front, and really the only ones that we know of that are doing this right here in Charlotte, North Carolina. We actually have been following their journey for the past couple of years. You might remember the product BioGown. We were talking about that for some time, and we're going to get into the background of this in just a second. But there's some new developments to talk about with the folks from Terraloam. So with that, I do want to bring in Jonathan Mustick, who is a co-CEO, joining us right here in the studio. And then we have your co-CEO, Jonathan, John Sharp, joining us via virtual chat. So we appreciate both of you guys joining us here in the Live Impact News studio or virtually to talk about what Terraloam has been up to. And as we mentioned, BioGown was a product that we've told folks about several years ago, coming out of the pandemic, essentially, this idea that y'all had. For folks who haven't heard about this yet or just kind of catching up on the headlines, tell us about BioGown. And by the way, we do have some pictures and video of the product itself and what makes this product so interesting. And I'll let Jonathan or John talk, whoever wants to.
Yeah, Vanessa, I'll start.
Cool.
So a couple back in the pandemic, both John and I saw a need for medical gowns, obviously within the Carolinas. So I converted my factory back then to make about 2 million plastic gowns for hospitals throughout North Carolina, South Carolina, and Virginia, actually all over the country. But in that, we realized how much plastic waste was generated from these gowns. And as an avid gardener here in Charlotte, one day I rolled out in my backyard and saw a drop of water roll off a broccoli leaf and said, if nature could make this impenetrable barrier, why can't we? So we worked with the Polymer Center, who's also right here in Charlotte, and created a compostable, first of its kind, compostable level 2 isolation gown. That was our original product, BioGown. And we've been using that now for about 5 years, and we've kind of expanded it to some additional product lines as we've gone along here.
Yeah, it's really wild to think that this is an answer potentially to just all of the waste that we see on a daily basis going into the landfills. And we understand, the medical community, there are a lot of protocols, right? Like they have to wear gowns in certain situations and certain products in order to keep the staff safe as well as the patients. But inevitably, there's only so much room, right? Like that can hold all that stuff. But this breaks right down, right? Like just if you were to kind of compost coffee grounds or whatnot in your backyard.
In a sense, yeah. We take the gowns from the hospital, we collect it, bring it to our composting site in Concord, which is about 6 acres, and mix it with other natural materials, coffee grounds, leaves from the community, mix it up, and in about 3 to 6 months that turns into usable soil. So for example, last year we collected about 171,000 gowns from Catawba Valley Medical Center in Hickory, which you guys did a story on a couple of years ago. Mm-hmm. We turned that into 300 yards of compost for the community that we've distributed around community gardens in Charlotte and in Hickory. Just for reference though, that 170,000 gowns in all of North Carolina, that's what's used per day.
Wow.
So even if one hospital, that's a whole year, but every day in North Carolina, we use that amount. And it just goes straight to landfill or is incinerated, which is even worse in my opinion because you're getting the microplastics and the particles going into the atmosphere. Yeah. We are slowly working our way through and building and expanding with other hospitals, not only in North Carolina, but across the country.
Yeah, and I mean, you mentioned the initiative with in Hickory. Mm-hmm. There are efforts to try to showcase what this product can do to various, I guess, healthcare systems across the area, which it sounds like has brought y'all to different states, and you're really trying to, I guess, show folks what this product, has the potential for. And there's kind of an Earth Day hook too. What can you tell us about your latest development that's coming up for Earth Day this year?
So one of the big setbacks or hardships that we would always when we were talking to hospitals was collecting the gowns and then getting them off site to either our composting facility or another composting facility across the country. We recently signed an agreement and worked with a company out of Ireland called Harp Renewables, who created a first of its kind biodigester that can actually take our compostable film, grind it down with a hospital's food waste, and turn it into usable compost in 24 hours, that takes our 3 to 6 month timeline down to basically nothing. And the hospital can use that right on their landscaping, donate it to local community gardens or other community aspects. So it takes a lot of the hard work out of our product and keeps it all on the campus of the facility, and also reduces the hospital's food waste bill, which is enormous and one of their biggest cost centers.
Yeah. And I mean, Jonathan, you and I have kept in touch for several years at this point, and I've spoken primarily to you about your endeavors over at Terraloam. I'm just kind of curious, John, joining us on a remote chat here. What has it been like, I guess, to be part of this company? And I guess speak to if there are any specific triumphs or if there are any specific hardships, because I know y'all have, like I mentioned before, really been trying to get this product in front of folks in healthcare systems near and far. So what has that been like, John?
Yeah, I appreciate that question a lot. And, truthfully, there is always a lot to unpack because, as Jonathan mentioned, we were born out of the COVID pandemic, and, we were able to kind of immediately see just a stunning amount of waste that's produced by the healthcare sector. And I mean, there are a lot of different sectors that produce waste, but in particular, we saw an amazing opportunity to explore alternatives to traditional plastics for healthcare. And so that has led us on a journey that we didn't anticipate, a journey that involves a tremendous amount of research and development, a journey that involves a tremendous amount of work in partnership with local hospitals, the Atriums of the world and Novants of the world, infection control, C-suite, supply chain, procurement. There's so many different aspects that we needed to explore in order to evaluate, will the BioGown work? Does this idea actually have merit? And can we, number one, assure that it performs extremely well in healthcare environments, which of course it can. And number two is, can we achieve this vision that we had about creating a kind of a fully circular model, where we deliver a compostable product that's used well in this environment, and then it's collected, it's transported to our composting facility, it's broken down back into nutrient-rich soil, and then it's delivered to places in need, community gardens, farmers, even landscaping. There's so many different applications. And so what that does is it has tremendous reverberations, just, compounding effects, that far exceeded what we've first imagined. So I'll give you a quick kind of example because it's kind of fun to look at some of the metrics. But if you look at every US hospital, basically every hospital that's using single-use traditional plastic gowns across the country, and they decided to convert to using the BioGown, that would, conservatively probably produce around 250 million pounds of produce every year. So that's basically the equivalent of feeding the entire city of, Miami for 12 months just by making that conversion. So there is a tremendous amount of potential that hospitals, can achieve just by evaluating the BioGown and just by embracing it in their system. So I think it's always going to be a fantastic thing to be a part of because the mission is something that everybody in the community is always backing. I mean, everybody, every hospital, to every vendor we work with. It's just something that will always be beneficial for everyone. And now it's about kind of pushing through and navigating as what you were saying to or alluding to, Vanessa, some of the kind of the challenges associated with just reaching the right person, right? I mean, when you talk about hospitals, I mean, healthcare, healthcare is one of the most heavily regulated, risk-averse industries in the country, and it's for good reason. These are organizations where a bad decision can literally affect patient safety. So, we have to, when we have something new like this, even as something as straightforward as swapping a plastic gown for a compostable one that looks and performs identically, the process is going to be deliberate. You're talking to sustainability teams, again, procurement, clinical staff, the C-suite, sometimes outside consultants. So a typical cycle from first conversation to first purchase order, I mean, that can be 6 to 12 months. I mean, sometimes even longer. And so we've been working with a number of these large health systems, especially here in Charlotte, for a couple of years. And for one of them, actually, we're just now launching a pilot, this month. So that's not a complaint. That's just the reality of selling into healthcare. And once you embrace that timeline, you can, I think it can almost be a competitive advantage for a small company like us because I think some of the larger incumbents are just not going to spend the time to handhold, on a single account. Whereas we will, right? We will show up, we will send samples, we will answer the phone, we will make it very easy. And in that respect, it's been a fantastic experience for Jonathan and I. We've really appreciated, meeting some of the most amazing people in the healthcare industry, especially around Charlotte and in North Carolina. So I'll stop there because I could continue on, I assure you.
I guess to that point, and this might be helpful, I guess maybe for a larger conversation of talking about sustainability and folks, whether this is their avenue or they have a different idea or concept that's, going to be something that's beneficial for the planet. What is some of the resistance? And I know you use the word kind of like risk averse. Like, do you find that the obstacles are mainly they just want to see a lot of data, or do you feel like there's some sort of, we're used to doing it this way? It's kind of tough to maybe get out of that mindset.
Yeah.
I guess what would you say is the biggest sticking point, I guess, for folks to kind of think of a new avenue?
Yeah, I think that's a great question. And again, like there's a lot to unpack there, and Jonathan, I think you can add to this in a second. But one thing I would say, and one thing that we've realized is that, long-term contracts and penalties can be limiting, so this is something that oftentimes just isn't thought about, but, when it comes to hospital purchasing, hospitals can be locked into long-term supply contracts. Often 3 to 5 years with their existing vendors. And, these are not casual agreements. These are volume commitments. There are pricing tiers tied to purchasing thresholds. There's, financial penalties if the hospital diverts spend to another supplier. So even when a hospital wants to switch, even when the sustainability team is completely on board, even when the procurement, acknowledges that it's a better option, they may just physically not be able to evaluate us until their current contract comes up for renewal. I think that's a barrier that we didn't anticipate in the beginning, but it is certainly one that exists, and it's not just for us, it's for every single supplier in the United States. This is something that they absolutely have to evaluate, and it can be frustrating because sometimes you feel like there's nothing you can do. I'll let Jonathan speak to some of the things that we have done, however, to make it easier for healthcare systems to work with us despite some of these kind of long-term contracts.
Yeah, one of the more recent, or in the last 6 to 8 months, is basically when we started this, because our material was so new and innovative, that obviously it costs more. And so you can have the best, most sustainable product in the world, but if it costs more for a hospital, they're not going to pay for it. And so even we have been able to reduce our price, and even recently we've now undercut the petroleum-based gowns and other products because of the what's going on in the Middle East right now. And even prior to that, before the Middle East, we had actually caught up on price, because for us, our main starch is a product or a item that's grown here, corn and potatoes.
Corn, yeah.
So all across the U.S. and especially in North Carolina too, we have it all locally here. And so oil, the price has gone up over the last 5 years, where our price of corn basically is maintained and stayed stable. So we've actually been able to now, like one of the big hospitals we're talking with in Utah, we're actually 14 cents under what they were paying for their gowns. So that hospital system, we're going to save them almost $500,000 a year, not even talking about the waste reduction part of it, where we're saving them from not having to take those gowns and incinerate them or put them in medical waste, which sometimes costs up to 35 to 65 cents a pound. So those costs add up for hospitals. So that's one of the big things we've really kind of stepped up in the last year, basically.
Yeah, you bring up a great point that I didn't necessarily think about, where, we'd been hearing, especially with tariffs, a lot of the local farmers had been worried about, well, who's going to buy our product? Because we had been seeing some backlash from outside countries, like who usually buy up maybe corn or whatnot. So it seems like your product ends up filling a niche there that might not otherwise be there.
Absolutely. And it's not even just our product, there's a lot of corn-based compostable items that are out there that are now coming back towards plastic pricing because of this. Basically the farmers don't have a place to sell their corn,
Yeah.
and the price has gone down or really maintained, but it's become very competitive for us now, and it's a big advantage that we have. And it's also one less, basically hospitals run on plastic products. You need that for sterility, you need that for surgeries and certain things, but if you can diversify that need a little bit, some compostable products, some petroleum-based products, at least it gives you a little balance and some flexibility when you're looking at costs over the next 5 years or so.
That's really, really interesting. Obviously, y'all have a heart for protecting the earth. I remember, when I first spoke with you, Jonathan, when you first came to me and said, hey, this is an idea that we've been working on. That was kind of at the heart of your idea. What is your hope? What is your goal for this product? Let's say it gets into all of the hospitals. What do you envision for the earth, for its people, because of this?
I think for us, I think it's a whole, we started in healthcare, and that's where we saw this need, but it's really one of the big things we donate this, food or the compost to community gardens. We have a local garden here in Charlotte, literally five miles from here.
Mm-hmm.
And the last 3 years, we've donated almost 4,000 pounds of food to the local community, which is in a food desert. And so our goal is to have more full service hospitals where you take this soil and have it on a community garden that's on the hospital grounds, have them really focus on the community's health aspect too, by using, hey, we care about you, we're taking these gowns, or taking these products that these guys make and turn it into food for you. And we also, there are, the concerns of health sometimes with gowns and blood and other pathogens on them. All of our products are tested by the North Carolina Department of Environmental Quality.
Mm-hmm.
So we have all that testing done every basically 6 months to make sure our compost is in line.
Yeah. Anything you want to add about what comes next? And it could be either you, Jonathan, or John. Just let me know who wants to take that one.
John, you could go for that.
Sure. Yeah. So our flagship product is the BioGown. That's what we've been talking about in this conversation. But we have more than that. We have the BioBaggie, which is a patient belonging bag. We have soiled linen bags. We have a chemo gown. We have an apron. So we have a number of products now that we are introducing to the market, and we're going to continue to do that as a company. We're going to explore products that serve as great candidates as a kind of compostable alternative. And all that does is it just adds to the potential impact, the positive impact that hospitals can make, and in a partnership with us. So that's one thing that we're going to continuously do. We're going to continuously work on, at a pretty meticulous level, improving all of our products in terms of performance, kind of their ability to perform well. That's a really important part of what we do. We want to make sure everything we build is completely safe and works really well and is extremely reliable. I think it took us at least a year and a half to go through some pretty heavy R&D to ensure that our products are just extremely reliable. So we've gone down that road, and we feel very comfortable about their performance now. So that's central to how we operate. That's how we're going to continue to operate as we move into kind of building different products and introducing them to different hospitals. And we work with their staff to do that, by the way. We work with infection control. We work with their C-suite to kind of develop a lot of these products. And that's one of the kind of, the most fun things to do as an organization. We're a small business, so we have we're a lot more agile. We can kind of move around, and we can pivot. We can work on different projects pretty quickly. So we use that to our advantage by building great relationships with so many of these healthcare organizations. So that's another thing I would add to the near-term roadmap for Terraloam.
Well, and speaking of relationships with healthcare systems, it sounds like there is a new one that's going to launch with Atrium Health Oncology.
Mm-hmm.
Jonathan, did you want to talk about that?
Yeah, starting next month, we're going to do a trial for our new chemo gown. We developed this, actually we're looking to get it patented as well, by having to infuse nanoclays into our material to slow the chemo drugs going through the material, which is kind of a cool part of the story because of North Carolina clay, and everyone knows about that here when you're walking around near your house and you get the red clay.
And you're cursing it usually.
Exactly, yeah. So it's actually interesting because the film has a little bit of a red tint to it because of the clay aspect, so it kind of adds to our story. But we're really excited about this pilot. We worked with the doctor down there and his staff to kind of design the gown to make it work for them, and then we're going to go a 3-month trial and then hopefully expand into a bigger aspect of atrium with that.
That's pretty incredible. I mean, where do y'all come up with the ideas?
Trial and error.
Trial and error.
A lot of back and forth, and we just kind of figure out ways to make things work and try to, again, reduce the amount of plastic that's out there. That's our main goal. So if we see a plastic item and think we can make a compostable alternative, we'll just give it a shot.
I know this is kind of off on a tangent, but I swear it's adjacent. Did y'all watch the Artemis 2 stuff, the launch, the moon mission? One thing that really struck me, and I feel like this is getting into that bit of a niche, but was Christina Cook, one of the astronauts, when she came back, and she said one of the things that really struck her, that she learned, this was something she got super emotional about. She got choked up talking about this, but said the thing that struck her was not just Earth, but seeing it with all the blackness around it and just realizing how much we're all in it together. This is our crew. She basically said, planet Earth, you're a crew and you're all in this together. And it just made me think about all the different ways that we could be working together really nicely to make sure that our crew, is successful and thrives. And so I just feel like I'm getting, samples of that and speaking with you both.
For sure.
I think that's a great read.
If you want to see and work on our compost site and see how much waste is generated, more than welcome to come up and lift some shovels with us.
And by the way, and Vanessa, it's a great read. It's a great read because it's true. I think at the center of what we do, truthfully, I think it's built upon the premise that life is precious. If you really kind of peel back the onion and get to first principles, what is it that drives us? It's the notion of protecting life is an incredibly precious thing. And, how can we do that in interesting ways in the private sector? And, for Jonathan and I, we decided that one of those ways would be to searching for alternatives and building a circular model that could, benefit the local community more so than just ourselves. I think that notion is incredibly powerful, and it becomes even more powerful when you shift your perspective, to the cosmos and you look back and you go, how precious our planet is. I think if you can walk day to day with that kind of mindset, inevitably you're going to have ideas. You're going to see things just a little bit differently. And if you're willing to walk across that bridge, incredible opportunity awaits. I think that's how we like to operate as a company. And I think part of our mission is delivering that message to our friends and partners at these hospitals. And, they get it right away because what they do day in and day out is preserve life. So they understand that concept very well. And I think that's why it's such a great thing to start here in healthcare and expand beyond.
It's been such a pleasure learning about your journey these past few years. Before we wrap things up, I guess if anyone out there watching wants to get in touch with y'all, just want to learn more about the product, or you mentioned getting a shovel and digging. Jonathan, do you have a best way for folks to get in touch with you?
Yeah, if you just go to our website, you can contact us through that, or honestly, you can email me at jonathan@terraloam.com or john@terraloam.com. We're pretty easy and responsive, but yeah, go to our website. We just recently revamped it, and you can check out everything we're working on and all the latest and greatest that we've been up to. So,
well, fabulous. Thank you, gentlemen, so much. It was a pleasure having you here on Live Impact.
Thanks, Vanessa.
It was a pleasure. Thanks, Vanessa.
All right, and we're going to take a quick break, folks. We'll be back in 2 minutes with more.